This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia, and I'm going to discuss ketamine infusions and how they're more effective at producing results in depression and mood disorders than oral and nasal spray ketamine. Yet all of these modalities play a role in the treatment of mood disorders and pain. Fall is upon us and leaves are starting to fall. Depression and anxiety are starting to creep into about 5% or more of the population as worsened depression or new onset depression that can be so severe as to lead into suicidal ideation. I use the example of a tree losing its leaves to represent the loss of dendrites on neurons and thus synapses and neuronal connectivity that leads to depression and mood disorders. This occurs as a result of genetics, stress, trauma, medical illnesses, poor nutrition, and many other factors. Depression is a story of neuronal connections and the loss of synapses or connectivity in key areas of the brain. It's also a story of glutamate imbalance in the cortex. Glutamate is a neurotransmitter involved in learning and pain. Inflammation, stress, genetics, glutamate imbalance, and other environmental factors result in the loss of neuroplasticity, neuronal connections, and even neuronal death, which produces mood, cognitive, and metabolic changes. As this occurs, we see a loss of cognitive abilities with disorders of executive functioning, poor decision-making, loss of insight, impulse control issues, and even brain fog. Fatigue, low motivation, and loss of reward and interest in our usual activities follow. As our cortical functioning continues to worsen, we lose control over our limbic lizard brain, and we start to experience the sadness and tearfulness aspects of depression, and eventually the ruminations, hamster wheel thinking, negativity, anxiety, fear, and self-sabotaging behaviors set in. This in turn causes us to develop maladaptive behaviors that causes loss of job performance, financial loss, relationship loss, and this results in even more stress and loss of neuroplasticity. With the loss of neuroplasticity, as seen in depression, there is usually volume loss in key areas of the brain, and this is due to neuronal death and the loss of supporting cells. There is also increasing brain aging by alterations in sirtuins and increased metabolic risks due to insulin cycling changes. These metabolic risks include increased risk in diabetes, myocardial infarction, stroke, and hypertension. This can result in the loss of 10 years of life in depression, not due to suicide risk, but rather due to these medical conditions. And this is what it's all about, neuroplasticity. Here we see the formation of a synapse and basically the connection between two neurons. And this is what allows us to learn. And also, in part, this is how ketamine therapy works, by increasing neuroplasticity to repair damaged circuits in key areas of the brain. Ketamine infusions are the most rapid treatment to achieve remission and response, with improvements seen in hours to several days. Ongoing improvements can be seen with continuing infusions even beyond the initial series of 6 infusions. The best chance of remission is with ketamine infusions as opposed to oral and nasal spray therapy. Ketamine infusions offer 100% bioavailability over a discrete period of time, usually 40 to 45 minutes in length. Its pharmacodynamics are more predictable, and this method of administration results in the most studied effectiveness in the treatment of depression and mood disorders, with consistent outcomes of up to 70% with response or remission. Nova Health Recovery has completed over 14,000 infusions. Ketamine infusions demonstrate safety and efficacy for both mood disorders and pain, with the most common side effect being nausea and vomiting in about 10%, a problem that is easily prevented with Zofran or Phenergan, scopolamine patches, and other types of antiemetics. Balance issues and dizziness can also occur due to the dissociative aspects of ketamine and the nystagmus that's produced with vision changes. And this is rapidly resolving. It improves within minutes to a few hours after the infusion is completed. Generally, the initial infusions are 2 to 3 times a week, for as many as 6 or as many as 10 infusions initially. You do not have to dissociate or lose control for this to work. For some, dissociation does make them feel better, kind of like a brain reset. But generally, the doses are escalating. They start at the lower infusion level, about 0.5 milligrams per kilogram, and they're escalated each time to a maximum tolerated dose with the least side effects. This dose can be around 1 milligram per kilogram over 40 to 45 minutes. But remember, more can be less, so larger doses are not always necessary to produce results. The infusion experience does not have to be happy or pleasant for it to work. The pathway to health does not always occur with happiness. So I can get the fact that you want rapid relief, but think about the good things in life that result from a little bit of pain, such as exercising for fitness, or getting a facelift, or a nose job, or a C-section. Each procedure is painful, but they result in a great outcome, such as a new face, or a nicer nose, or a new baby after a C-section. So most infusions can be indescribable and enjoyable, but really the goal is neuroplasticity and glutamate rebalancing. So we follow clinical outcomes in using validated measures as well as self-report to determine how a person is doing. We use like the PHQ-9, the MADRS score, and the General Anxiety Score 7, the GAD-7 score. These are just examples of scoring systems that we use to monitor depression or anxiety improvements. An improvement is usually seen around the fourth infusion, but sometimes it's seen sooner, sometimes it's seen later. And improvements can occur in various domains initially, such as increased happiness, less brain fog, less fatigue, while other domains may take longer to improve, such as negativity and hot cognitive deficits, which include lack of self-awareness of improvement when there is improvement and overestimation of side effects. For many, there are continuing benefits beyond the initial series of infusions as they combine treatments with psychotherapy, behavioral changes, and lifestyle changes. So ketamine infusions are a treatment, not a cure. Follow-up booster infusions may be required in several weeks for many. And at-home therapies with oral ketamine and nasal spray ketamine, which is not just S-ketamine alone, but 50% S-ketamine and 50% R-ketamine, can also help to maintain effectiveness after the initial IV ketamine series. Baseline medications can work better as a result of the ketamine and also faster with ketamine therapies. Oral and nasal spray compounded ketamine can be used at home to possibly expedite this improvement or maintain the gains from infusions. So an IV ketamine session is administered through a small peripheral IV 24 gauge or even larger if necessary, with basic monitoring such as blood pressure, cuff, heart rate monitoring, and pulse ox. The environment can certainly be said to be a non-medicalized type environment for the most part, with comfortable chairs, warm blanket, home-like furniture, and galaxy lighting. The treatment is extremely safe and low dose relative to anesthetic dosing, as you see in other types of procedures. And turning off the infusion stops the psychedelic effects within minutes. Any anxiety that occurs during the infusion can immediately be addressed by changing the timing of the infusion, stopping it, redirecting thoughts, or using sedatives if absolutely necessary. There is no need to lose control or dissociate during this process. And studies have demonstrated that repeat infusions are the only effective way to maintain ketamine's effectiveness. There is also evidence that psychotherapy applied between sessions can help improve and maintain outcomes. There is less evidence for in-session ketamine-assisted psychotherapy sessions, but some patients do find this helpful. And oral ketamine with nasal spray ketamine boosters can certainly be used to lubricate the ketamine-assisted psychotherapy sessions to allow cognitive flexibility during these therapy sessions when patients are stuck in therapy, when they have hamster wheel type thinking, and when they just aren't able to reframe or reprocess information. Certainly lifestyle changes such as dietary changes, addressing eating disorders, restructuring your environment to remove toxic things, planning and scheduling events to fill downtime, exercise, also high-intensity interval training, addressing substance use disorders, adding psychotherapy, addressing maladaptive behaviors, and also reducing stress are all important to promote healing. Certainly, ketamine therapy certainly changes the and also repairs the biological mood through synaptic plasticity, but not the world around you. It cannot change your boss. It can't change your personality. It won't change your family. It won't make you clean the house. You need to activate the inner healer. Most of the work is up to the patient. It's up to you to actually get the job done. So you'll need to put the work in to make that change. And if you're just medicating yourself to escape, or if you're just over-sedated most of the time with your regular prescription medications or with substances, whether it's benzodiazepines or opiates, marijuana, gabapentin, alcohol, and other sleep aids, you'll need to consider a tailored form of detox. And some patients do not realize that they're actually checked out most of the day, and a secondary observer can be needed to verify the person's functional levels. So it's important for individuals to learn new coping skills and not to try to medicate away fears and mood, so that you can actually start to learn from your moods. And if you don't challenge yourself, you're not going to change yourself. So it's really important to kind of extract other medications that may be actually impairing your ability to heal. We have utilized multiple ketamine strategies at Nova Health using evidence-based approaches in 14,000 initial ketamine infusion series, booster infusions, at-home oral and nasal spray ketamine for maintenance, as well as the adjustment of medications, adding psychotherapy support, and addressing lifestyle changes, have produced excellent outcomes where traditional therapies alone have failed. Everyone is unique and requires a tailored intervention based on their mental health journey. We prescribe a regimen that fits the individual based on their medical evidence as well as clinical experience. You can start treatment for pain and mood disorders with at-home options without using initial infusions. These certainly may take longer to work, sometimes several weeks, and are less likely to produce remission, but certainly can provide relief. There are fewer studies that have been done to show efficacy with oral and intranasal ketamine, but clinically we have found that at-home therapies can be very helpful as initial treatment and maintenance therapy after infusions. So what are the available types of therapies? There are ketamine troches, ketamine RDTs, which are ready to dissolve tablets, ketamine SR capsules, which are sustained release, ketamine dots, and ketamine nasal spray, which is racemic ketamine, a mixture of right and left-handed ketamine in a 50-50 mixture, which is different than Spravato, which is basically just S-ketamine alone. Compounded ketamine nasal spray has a high absorption rate of around 40 to 60% and can be used at home if it's not the FDA-approved version of ketamine called Spravato, which is S-ketamine alone. The dose can be adjusted rapidly and it can have noticeable psychedelic effects. The goal is generally microdosing for at-home therapies where you really don't feel the psychedelic effects. And that's generally best used formulation. However, some people do find that obtaining those psychedelic effects and dissociative effects can certainly be more helpful for them to basically achieve a better mood state. Now, this can be used immediately after the use of troches, augment the effects of the troches for CAP sessions, or just to maintain the effectiveness of troches throughout a ketamine-assisted psychotherapy session. The amount of milligrams in a spray of ketamine compounded dosing is anywhere from 5 milligrams up to 20 milligrams, and burning and bad taste are the main side effects, with nausea and dizziness as always being another side effect. A meta-analysis demonstrated that ketamine infusions produce more response and more remission than ketamine nasal spray, that is the FDA-approved version, namely known as Spravato. So infusions are much better than, generally speaking, nasal spray ketamine, and in particular the FDA version, Spravato, based on a meta-analysis by Bahi and his group in 2020. So this bottle of ketamine is 500 milligrams of a total dose in the 10 cc's, and it can treat between 5 to 10 patients for one session, or complete an entire series of 6 initial infusions for one patient over 2 weeks. At the therapeutic dose of 0.5 milligrams per kilogram over 40 minutes, a steady, controlled session can be achieved. The troche on the right is a waxy 250 milligram dose, and this particular dose or troche can treat one patient exactly once, and so you would need 2 of these troches for 500 milligrams would be 2 treatments to be the same as basically the total number of milligrams in this bottle right here. Now, clearly the power of IV ketamine can be seen from this example, as 2 of these troches allow only 2 sessions for the individual, and one bottle of this 500 milligram ketamine vial can actually treat 6 to 10 different sessions. And so this is just like IV antibiotics for an infection. So in a severe infection, increasing oral antibiotics doesn't work well for most infections. And so you need the reliability and strength of IV antibiotics to be used. And the same thing with IV and oral hydration. Sometimes IV hydration is significantly better. And similar thing when you compare IV ketamine to oral ketamine or even intranasal ketamine. So ketamine troches can be compounded in various strengths depending on the person's needs. And these doses can be as small as 25 milligram pick-me-up doses to several hundred milligrams per dose inside each troche. Now, about 20% of the dose is absorbed after it's held under the tongue for approximately 10 minutes, and the effects are seen in about 10 to 15 minutes after you start to absorb it under your tongue. And these effects can be lasting as long as 30 to 40 minutes. If there are any psychedelic effects, certainly that's the period of time that you'll feel the peak of them. Now, these doses are designed to give a specific therapeutic and neuroplastic effect, and they're not designed for anesthetic dosing, so you have to set things up just right so that the person is getting an effective dose, not anesthetic dosing. And microdosing could certainly be helpful as a maintenance therapy or provide relief in depression and mood disorders. Such dosing provides no trippiness, so again, microdosing should provide absolutely no psychedelic effect. Oral and nasal spray ketamine can be used to lubricate the psychotherapy process and increase psychological flexibility so that the person can start to think outside the box during a CAP session. Now, ready-to-dissolve tablets provide a chalky, explosive option to administer doses more effectively. These tablets are absorbed under the tongue as well, and they come in strengths of up to about 200 milligrams. And there are studies demonstrating that oral and intranasal ketamine can maintain the effectiveness of ketamine infusions. And these studies have used variable dosings, and this is just one example of one study that utilized oral ketamine to help maintain the effectiveness after IV ketamine infusions. So each person and their needs are unique. A personalized care plan should be developed and tailored for each individual. This isn't a one-size-fits-all treatment. Multiple aspects of care should be addressed, such as substance use, pain, eating disorders, obesity, diet and nutrition, trauma, medical conditions, medication side effects, exercise, sleep, maladaptive behaviors and coping mechanisms, stress, exercise, structured time, and therapy. Ketamine is part of the treatment process. It's not a one-and-done therapy, so the provider needs to have awareness of multiple domains of the individual. So the comparison between ketamine infusions versus at-home oral ketamine and nasal spray ketamine is listed here. We know ketamine infusions are more rapidly effective. They're more likely to produce remission or response relative to oral and nasal spray ketamine. It's 100% bioavailable, has more predictable outcomes based on the weight and timing of the infusion. The controllable effects of ketamine infusions are quite obvious. It's easy to intervene on any side effects during any type of treatment. And it has a rapid onset and offset of trippiness. So the moment the infusion is done, pretty much the ride is over. It can also be used to treat, any individual who is having an infusion. If they develop anxiety or nausea, you can instantly use sedatives if needed, or adjust the rate of infusion, or even stop the infusion for a period of time and address the anxiety or the nausea with the appropriate medication. And many people will actually go to work before their infusion and the day after, so you're perfectly fine to work the following day. And most feel cognitively normal within about 30 minutes after the infusion is done, but their balance may be affected for several hours. It's extremely safe. Nausea, dizziness, brief blood pressure, and heart rate changes can certainly occur. They resolve immediately after the infusion is done. But the negatives for ketamine infusions are they're more costly. They require a ride, as you can't drive afterwards. It does require an IV and some periodic maintenance infusions. Now, home-based ketamine is slower to take effect for depression, anxiety, suicidality, and mood disorders. So it may be several weeks before the peak effects are seen. You certainly can get rapid relief, but the actual effects aren't seen for some time. And less likely is this going to produce remission, but it certainly provides relief. It can be used in the comfort of your own home. No journey is required for effectiveness, and you can use microdosing, meaning you don't feel any trippiness. It's certainly less costly because a troche is about $7 to $15. You can do it once or several times a week. You can use this to augment your underlying medication support, or for ketamine-assisted psychotherapy support as a lubricant for that process of psychotherapy. And frequently, at-home therapies are used to provide maintenance after ketamine infusions. No IV is required. And the negatives are it tastes bad, and it is also associated with nausea and dizziness as well, and it can certainly produce an altered mental state that can be a little bit more prolonged and less controllable than the IV formulation. And of course, there's variable dosing with the ketamine oral and intranasal formulations. So basically, the key points are ketamine therapy works rapidly within days. Ketamine is very safe in the treatment of mood disorders. It's administered as an IV infusion of 6, generally over 2 to 3 weeks. Each infusion lasts about 40 to 45 minutes with doses escalating between each treatment. And you have to certainly add psychotherapy, integration psychotherapy, usually at some point after an IV session. And ketamine does treat a number of different disorders, everything from suicidality to severe depression, OCD, PTSD, anxiety, bipolar depression, and pain. And certainly, low-dose oral and intranasal ketamine can be used safely at home for maintenance and also for lubricating psychotherapy. And we can see is upwards of even up to 70% of patients with treatment-resistant depression have improvement or remission. So the general treatment process are determining if the person's condition is treatable with ketamine and if the person has any medical conditions that might interfere with this treatment, such as heart attack or stroke, uncontrolled blood pressure, diabetes, or schizophrenia. And then doing a medical intake and mental health preparation in which we discuss the treatment risks, benefits, expectations, and follow-up treatment. And we discuss how ketamine works in the neurobiology of your condition and also any additional medical treatments that certainly would help augment the outcomes, and integrative treatments and options, as well as lifestyle discussions, and also addressing addiction and eating disorders and obesity, as well as nutrition if they're an issue. And then starting the ketamine therapy process with a specific dosing over a specific period of time, 2 to 3 times per week, It's important to not extend the dosing sessions more than several days between infusions to maximize your outcomes. You need a driver as well. And after these initial series, whether it's 6, whether it's 8, whether it's 10, basically the person would then go to an at-home therapy of oral or nasal spray ketamine for maintenance, as well as continuing their ketamine-assisted psychotherapy or just regular therapy sessions, periodic booster infusions, lifestyle changes, medication adjustments, self-monitoring, and then just general follow-ups.